Hi friends, I am Dr. Pratap Singh Rathore. I have done MD in Forest Medicine, and today we will discuss about child abuse. Child abuse can be defined as causing or permitting any harmful or offensive contact to a child's body or any communication or transaction which humiliates, shames or frightens a child. So if any form of harmful, if it is a harmful by offensive contact on the body or any form of communication or anything which may humiliate, shame or frightens a child is considered as a child abuse. There are different types of child abuse. There is physical abuse, sexual abuse, emotional and neglect. Physical abuse mainly includes like physically giving some like form of beating like that. It includes any non-accidental physical injury caused to child caretaker. So the word non-accidental is very important. The injury should be caused intentionally, should be caused to the child. It should not be like child just suddenly fell down from the bed and caused the injury. It should be non-accidental physical injury caused by. It should be caused by a child's caretaker. It may be parents or any guardian. It can be any form like beating or battering of a child. So any form of that can be included. Sexual abuse, which is a form of again serious type of offense. It is now covered under POCSO Act, where any form of abuse, sexual offense caused to children comes under POCSO Act and is treated as a form of sexual offense, and the person is punished according to it. Sexual abuse refers to inappropriate sexual behavior with the child. So it may include any form like fondling a child's genitalia, making the child's fondle the adult's genitalia, having intercourse, having incest, rape, sodomy, exhibitionism, indecent exposure, and commercial exploitation through prostitution or production of pornographic materials. So any form of may be present. This all comes as included as POCSO Act, comes included in the POCSO Act, and it is punishable according to that. Next comes the emotional abuse. Here the child may not be physically tortured, but emotionally by verbal, mental, psychological maltreatment is given. So it mainly includes like act of commission where physically something is done to make the child emotionally disturbed, or act of omission where the child is not taken care enough by its basic necessity is not taken care of, which can potentially damage the child psychologically. This can include like parents caretakers using extreme or bizarre form of punishment such as confinement in a closet, dark room, or being tied to a chair for prolonged long periods. So child may be sent outside the house, child may be confined in a closed closet, a child may be made isolated in some place like that. In form of emotional abuse is given. Next is a neglect. The neglect is nothing that it is a failure to provide child's basic needs. Neglect can be physical, educational, basic needs like basic clothes, basic food, basic medicine treatment is not provided. That is the neglect of. It is considered as a form of child abuse. So any form of injury when the child comes under, we should know whether the child has been physically abused or it is because of some diseases. So differential diagnosis of any injured child is very important. So childhood fractures can be caused because of some other conditions like severe brittle bone diseases like congenital syphilis, rickets, scurvy, leukemia, then associations imperfecta, copper deficiency, Menkes syndrome. So there are different diseases which can cause easy fracture of the child's. So you should be known whether the child has been beaten to which are related to fracture or it has been because of diseases. Sometimes it can be these diseases can be used as a defense by the parents in the criminal trial for as child abuse on grounds that such fractures can be observed with normal parenting handling or spontaneous movement of child also. So it should be considered that clearly understood whether the child has been some disease is present or just because of abuse the child has experienced fractures. So among child abuse, there are few conditions which are named as second baby syndrome, beta baby syndrome. First coming to second baby syndrome, this is seen in infants who are less than 1 year of age. They are very susceptible to this type of injury. This leads to susceptible to subdural subacute hematoma and retinal hemorrhage due to vigorous shaking of the baby as a method of punishment. So here the child is held up and vigorously shaken from to and fro motion, which leads to the because of movement of the head inside the skull, it may lead to subdural subductal hematoma, and which in future may also cause some psychological damage, or the child may end up dead also. Reducing factors, mainly the infant's relatively large head, weak neck muscles, and delicate subacute bridge vessels are some where Even the slightest shaking also may lead to some damage. Signs and symptoms include like seizures, irritability, meningitis, and focal or general neurological deficit. Diagnosis mainly by CT and MRI scan, bodily spinal fluid or subdural fluid, and by normal scale X-rays, it can be confirmed that hematoma can be diagnosed. Next type of abuse which is commonly seen is the battered baby syndrome. There are different names for that, is like cafe syndrome or maltreatment syndrome is also given. So in battered baby syndrome, it is defined as clinical condition in young children, usually under 3 years of age, who have received non-accidental violence or injury or on one or more occasions at the hands of adult parent, guardian, or foster parents. So this is form of physical abuse where there is mainly children of less than 3 years of age are undergoes this type of abuse where they receive non-accidental violence. Again, non-accidental violence is present on one or more occasions. So it should not be just a one occasion. It should be more than one or more occasions at the hands of any type of any adult, maybe parent, guardian, or the foster parents. So anyone can cause the Beta Baby syndrome. In addition to physical injury, there may be some non-accidental deprivation of nutrition, care, or affection. This also included as in the Beta Baby syndrome. Here, the child will not be provided not only the physical injury, but some deprivation of nutrition, not providing food, care, or affection is also included in this condition. Features of Beta Baby syndrome: mainly the age is below 3 years of age. Males are more prone to compared to female child. Usually illegitimate and unwanted children or unwanted pregnancy or failure of conception children are more prone for Beta Baby syndrome where the parents are didn't want the child and because of that they try to abuse the child. Commonly seen in the eldest or the youngest of the children. Next, related to parents, features related to parents. Many times unmarried couples are prone for child abuse. Usually parents are young, they do not understand the responsibility of the child rearing, so they undergo child abuse. Then they may have some lower level of educations. They may have some reckless lifestyle, doing some adventuring works like that, often indulging in drugs. If when they indulge in drugs, they may try to beat the children. Often the parents themselves were the victims of battling, so they again beat their own children. Sometimes they also have some psychological factors like low trust issued, impulsive nature, aggressive personality, and imbalanced temperament also may be one of the reasons which predispose the Beta Baby syndrome. Some social family factors, mainly the low social background, lack of equality between members of the family with lack of family harmony, long-standing emotional problems, financial hardship, trouble at place of works. So these are some social family factors which predispose. So the person who is already been abused or scolded by the boss in the family, that parents may try to beat the children by abusing that. They have some financial hardship. They may have some trouble at the place of work. They have some emotional problems with the wife, husband and wife. They may have quarrel, and child may be a third party which has bear that abuse. Some present factors of Beta syndrome. Mainly the child may disobedient, not listening, not eating the food. In these conditions, it may predispose them to have to be beaten. Frequent crying may create some annoyance. Refusal to take food, soiling of napkin and bedclothes. Any favorite, some parents may have some favorite items which may be soiled by the children, and suddenly the parents may get angry and may try to beat the children. At times, an ineffectual act of child may annoy the mentally challenged fathers or mothers. Sometimes, even some small act which may not be serious enough, but the parents who are psychologically some depressive may try to abuse the children. So, what are the features which should arise the suspicion that child may be abused? Some first is the parents which give vague history of accidents. So whenever the child has some injuries, they may bring to the casualty or hospitals claiming that they have met with the accident, some child met accidents and caused the injuries like fall from the stairs or caught, which do not appear consistent with the type of injuries or time related by the parents. So most of the times the children may be bitten by the hand or stick or like that, and they may claim that they have fell from the stairs, which mainly doesn't the shape of the injuries, the size, shape, the age of the injuries will not correlate with the injuries which the children have experienced. Often the parents gives history of tendency of child to bruise easily also. Sometimes the child tell that even if we hold the child, it will bruise. So they often give some vague history of that. Sometimes parents of child seek medical aid rather than late or when the condition of the child becomes very serious. Often injuries in different stages of healing are found in children. So as once examined, they usually bring the children for very late examination. Sometimes even after many times at the stage, many stages of injuries may be seen. One of the injuries may be healing, one of the injuries may be still recent. So many stages of injuries may be present. In many cases, parents later admit to have assaulted their children, but only mildly for punishment. Even though they admit that they may have abused, they do not admit that it is abnormal. They just tell that it is normal to beat the child for because the child is disobedient. Injuries seen in the child abuse mainly includes seen on the hands, foot, teeth, stick, belt, shoes, hot water, cigarettes, hot frying pans, or any other household articles are being used to cause the injuries. So any form of it may be used, like they may bite other children's, which may stick, they may use belt, their shoes, hot water may be thrown, lighted signature cigarette may be used, hot frying pan may be also be touched to the children's, or any household articles may be also cause the injuries. This is injuries includes like bruises, abrasions, lacerations may be seen. Lacerations of oral mucosa along with labial frenulum of the lower lip is a characteristic lesion. So if the child is bitten on the face, the labia frenulum will be lacerated. Slap marks, lash marks, knuckle punches, pinch marks. So pinch marks is like a butterfly pinch will be present. So if the child is pinched, one side will be longer, one side will be like a at the one end, they both the end will be bruised, but one the middle it will be not be pushed because of pinched from between the two fingers. So at which it is larger, it is mainly because of thumb, and one is because of the forefingers. So this type of butterfly finger bruises is commonly seen because they are pinched very hardly on the limbs. Bald patches on the scalp due to pulling of the hairs may be also be seen. So these are some of the injuries seen in the black eye, slap marks, cigarette butt injuries on there. On the buttocks, there may be injuries may be caused by the shoes or by the belts mark may be seen. Bite marks may be seen, butterfly marks, butter bruises may be also be seen. Injuries inflicted on the throwing the child, striking the child with fist or object or against a wall, dropping the child, or vigorous shaking of the infant, the shaken baby syndrome, may lead to some intracranial hemorrhage leading to CNS injuries. A strong suspicion of child abuse should be made in a child presenting with altered mental state, unresponsiveness, coma, convulsion, or cholinergic deficit should always suspect that they may have some internal hemorrhage may be seen. In the eye, there may be retinal hemorrhages unless displacement may be seen because of repeated slapping. There may be injuries on the spleen, liver, or hollow viscera, which result in massive hemorrhage, shock, and death of the child. There may be burns caused by circular pattern bruises, which indicates that cigarettes were used on the skin. Scars can also be commonly seen. Then sometimes many fractures may be caused transverse fractures, impactor fractures, spiral fractures, metaphyseal chip fractures, subperiosteal hematoma, and multiple deformities of the long bones. Rib cage can also be seen. Fractures of the long bones, ribs, skull, vertebral bodies are highly suggestive of abuse. Usually after 1 to 2 weeks, calluses form the X-rays like a string of beads. So, so during the healing stage, there is a string of beads may be seen on the rib cage because of healing. Blunt traumatic chest may result from multiple rib fractures, then pneumothorax, rupture of diaphragm and cardiac tamponade may also be seen. Physical sexual abuse may lead to genital injuries like hematuria, dysuria, frequency of urination, and enuresis. Diagnosis mainly because of nature of injuries. By examining the injuries, you can guess that a child may be abused by because of sticks or by pinch marks or bruises. Can guess that a child is abused in such a way. Then delay in seeking medical treatment. So any parents, when the minor injuries may be treated immediately, but when they seek medical treatment very late, it should be considered child abuse. Then many recurrent injuries may be seen, which is also should be suspected of child abuse. Radiological manifestations, especially those involving the ribs, metaphysical physical injuries, and abusive fractures of the clavicle acromion process should be also be commonly seen. Cause of death in child abuse: head injury is common, with or without skull fractures, is leading cause of death in the child abuse, followed by rupture of the abdominal viscus. Postmortem examination of the child of child abuse. History may be completely misleading as the circumstances surrounding the death. External and internal examination should be very thoroughly and supported by photographs, radiographs, and microscope section of lesions. Toxic analysis should be done to confirm the types of injuries, and internal injuries should be also be confirmed. Medical importance. In India, as per Eastern cultures, childs are considered to be gifts from the god. So mainly, many times it is not. Children are not uh, born for Beta-Baby syndrome. Very rare, but there are instances of ill treatment is present. They are if the child any child abuse is considered as offense, and if the child dies, it is considered as infanticide. It is punished according to infanticide. Now coming to one more form of abuse is Munchausen syndrome by proxy or factious disorders. So it is a form of abuse in which parents or guardians fabricates or produces symptoms of illness in the child in order to gain sympathy or attention for themselves. Here the parents themselves have some psychological disorder where they want attention from others, so they take children from one hospital to another and present with the fabricate some form of illness in the children. Though children are normal, they fabricate that children have some form of illness. The parents frequently have abnormal borderline personality disorders. Diagnosis may require high level of suspicion and may be met with considered resistance from the family. So many times these illnesses are produced by different ways, like mother may prick her finger and add blood to urine of the child and takes the sample to the doctor, claiming that the child has blood in the urine. Child's nose may be closed with two fingers and lower jaw pushed up in the palm to block the airway to make the child suffocate, and later on taken to them to stimulate some form of asphyxia condition. A pillow or towel is put over the face of the child and face is pushed down into bed clothing, again to cause form of asphyxia. The mother may give insulin to the child and take it to the hospital with hypoglycemia. Sometimes they may give some ipecac to cause vomiting in the children also. Cause diarrhea, they may cause, they give some laxative salt poisoning. They may give some drugs like theophylline, insulin, or saccharomyces to cause convulsions. Some anticoagulants, phenolphthalein poisoning, or exogenous blood may also be given to cause bleeding. So mainly the parents or their grandparents may have some anticoagulants. Thus, tablets may be given to children to stimulate some form of illness, serious illness, to claim the sympathy. Sometimes they may also give barbiturates or diazepines, or they allege that the children have fever, or they may cause come from scratching or intoxication, giving some form of irritant, applying irritant on the skin of the child to cause rashes also. So those way the way they show the illness. So there is one criteria, Rosenberg criteria, to claim whether the child, whether the parent have this Munchausen syndrome by proxy. Here, first is the illness alleged are produced are both by the parents. So the parents allege that children have this disease, but it is not proved by the examination of the child. Repeated requests for medical care leading to multiple procedures. So here they have multiple uh, trust. They request for multiple tests. They do go for multiple medical care. Parent denial for knowledge or cause of symptoms. So they deny whether how the symptoms may have occurred, where the child got those symptoms. Then regulation of symptoms when the child is separated from parents. So this is one important criteria where if the child is separated from parents, the children doesn't have those symptoms. So this is a few criteria which has to be met to be considered that parents have this condition. Features of Munchausen syndrome. The child may brought with vague complaints such as vomiting, diarrhea, fever, seizures, infected parents intestinally or repeatedly. For example, bleeding may be caused by anticoagulants, assimilated by exogenous blood. Seizures may be caused by suffocation, shaking, or intoxications. Vomiting can be caused by giving ipecac syrup, or fever triggered by injecting some contaminants into IV lines while the children is in the hospital. So the child will be with vague symptoms, providing some illness, any form of illness by giving some drugs. The parents or guardian derive some non-economic benefits at the expense of victim. So sometimes the parents may get some benefits, non-economic benefits may be there. So because of that, they also do these conditions. Some preparators, doctor shop while maintain consultation with one or more healthcare providers. When confronted, the parents or guardian usually deny any allegations causing the victim's conditions. So whenever you confront it, they deny that they are doing these kind of conditions. Diagnosis: mainly the illness does not confirm or expected presentations or follow the usual course. So when examined, you can confirm that whether these symptoms do not correlate with the signs of the child. The signs symptoms are not substantiated by laboratory or imaging findings. Failure of wounds to heal also is one of the way with wounds which are inflicted. The parents may try to increase the wounds whenever the small wound is there. They do not want to get healed, so that they continuously get attention from the hospital. So they will not allow the wound to heal also. This all should be present for confirming that the parents have MHSP. The child becomes ill or worsen when the parents or guardian is present, with recovery when separated. This is also one of the conditions we can diagnose, that when the parents are present, the child worsens, but when they are separated, the child recovers. Positive drug or toxicology analysis for something not prescribed for the patient. So sometimes some drugs may be present while doing toxicology analysis in the blood of the children, which confirm that they have given some drugs. Finding that the patient has been admitted to multiple hospitals and has been seen by multiple physicians. So once, sometimes while examining also, they will confirm that the doctor may be friendly with other doctors, may come to know that the parents are moving from one doctor to other doctor also is seen. Now coming to reporting of suspected child abuse. So child abuse should be reported, and it is punishable, and it should be reported whenever it comes to the notice of a doctor. It is mandatory to report any suspected child abuse in other USA or Argentina. In certain other countries like Russia, Japan, reporting is voluntary. It is duty of the doctor to report to the concerned authority regarding a suspected case of child abuse. These are my references. Thank you.